Last week, we heard from Dr. Rick Lofgren from UC Health about the situation in Hamilton County. And as we said, we focus a lot today on Hamilton County, on Montgomery County. Today, we'll hear from Dr. Michael Dohn, the Medical Director for Public Health, Dayton, Montgomery County. The doctor's professional experience includes clinical care, research, 15 years living and working in the Spanish-speaking Caribbean doing community health development. He served for more than a decade on the full-time faculty at the University of Cincinnati College of Medicine, and has also served on the faculty of the Wright State University Masters in Public Health program. He received his medical degree from the University of Cincinnati and his public health degree from London School of Hygiene and Tropical Medicine. Doctor, thank you very, very much for joining with us. We appreciate it, and I wonder if you could just kind of give us a rundown of what you are seeing in the county.
Thank you, Governor Dohn. I think that your synopsis was really very good in terms of we were averaging around 10 cases per day, and now we're up to 4 times that number. The Montgomery County residents, when the original stay-at-home orders came through, were very good about being compliant with that and about staying home. We know from the cell phone data and other measures that the community really responded to that. And we had very low case rates. As testing became more available, we expected to see more positive tests, but what we're seeing now is not what we were hoping for or could be explained by simply the testing alone. We have more cases, we have more people seeking medical care, and more people going to the hospital and being admitted to the hospital. The hospitals still have plenty of capacity at this point, but it all indicates that there are more people who are getting sick with this disease than there were previously. We're also seeing something we hadn't seen before, which is clusters of a couple dozen cases related either to a workplace, in some cases to a single church event, where people have been able to spread this virus amongst themselves. So that at this point, we're concerned that, especially with the holiday weekend coming, that we're going to see continued mixing of people and some continued increases in the cases, which makes us sad because we think this is something we could prevent in so many ways with just simple measures like wearing masks and maintaining that 6-foot distance.
Well, thank you very much. Are you seeing anything else in the data about who is getting sick? If there's any change? I know we've seen in some other states, it appears as some of the more younger individuals, 20 to 40 maybe, seem to be showing up more. Are you seeing that in Montgomery County, or any change in that at all?
Yes, well, as has happened other places, at this point, the group that's 20 to 39 years old now accounts for well over 1/3 of all of the cases, which was not the situation previously. And one of the things that worries me about this is a new virus, and we don't really know what the long-term effects may be, so that even if younger people may come through the acute illness in better shape than older people with less complications, we're not sure what the long-term implications are going to be. And the reports, for instance, that there's decreased lung function afterwards, if I'm young, I've got a lot of extra reserve lung function, and I may not miss it at this point, but at some point in the future, I may want to draw on that as I get older. And so I think that's a concern to me as well. Also, just the sort of intermixing of people. If the more that we see cases, the more that we see younger people beginning to get this disease and perhaps being able to spread it unwittingly to others around them, the more concern we have for the vulnerable populations, people that are already sick, even people in those age groups may have quite a bit of trouble with this virus, even if they're younger, if they have underlying diseases. And so that's a concern to us at this point.
So you could get, I guess, someone who's 20, 30 could get it, and then you may see another bump then beyond that, maybe to somebody older, I guess. In other words, a person who's young gets it and may go home. The classic case that I always talk about is, if you're 20 or 30, you need to worry not only about yourself. If you don't worry about yourself, you need to worry about someone older or someone who has some medical problem that you might end up giving it to. And I don't know anybody that you know, even if they think they're invincible, no one wants to hurt somebody else and give that to somebody else.
Exactly.
Doctor, any final advice as we move forward for people in Montgomery County? You know, you talked about you know, it is a holiday, and 4th of July is coming up.
Well, I think everyone sort of knows the rules at this point, if you will, that we should maintain 6 feet distance, that we should wear masks. Certainly, if we're inside, there's much more chance of transmission than if we're on the outside. Still, the masks can be helpful inside and outside in maintaining that distance. One of the things that we've encouraged people in Montgomery County to do is to just be aware of your surroundings and look at what's going on. And if you find yourself in a situation where you feel people are packed too tightly, if a lot of people aren't wearing masks and trying to protect you from themselves if they should by chance have the infection and not know it, we're asking people to make those assessments, watch where you are, and if you're uncomfortable in a situation, then move out of it. Find a place that you can go and that you can enjoy the weekend, and you don't have the same kinds of chances of transmission and of getting the virus. So whether it's a store, whether it's a park, whatever the situation, we're asking people just to be very watchful and to take care of themselves and to be thoughtful, not only of other people by wearing a mask, but just thoughtful about their situation and whether they feel safe in that situation or need to change that.
Good. Dr. Dohn, thank you. We appreciate it very, very much. Thanks for all you do, people of the county.
Certainly. Thank you.
Thank you.